My name is Olivia Luera, and my speech is going to be about obstetrics and gynecology. When I was younger, I really was interested in the medical field, like always doctoring my brothers and asking nurses anything and everything about what they were doing. As I grew older, the woman side of medicine really stood out to me, so I started looking into obstetrics and gynecology. I went on a website, totalwomanhealth.com, and do more research on the career of an OBGYN, which is a doctor with specialized training in obstetrics and gynecology. And I decided that's what I really like to become. And obstetrics deals with the care of pregnant women. It's the preconception period to pregnancy and labor and childbirth to after the baby is born. And gynecology is the general care of women, and it can be the female reproductive organs, breasts, and sexual functions. It also includes management of hormonal disorders, treatment of infections, and training in surgery to correct or treat pelvic organ or urinary tract problems. An OBGYN can also offer preventative care such as exams and routine tests to detect early problems. They can give immunizations to prevent diseases, and for many women, their OBGYN is their primary care doctor because they can provide care for a wide range of medical issues, much more than just pregnancy, and they can do that because they're evaluated and trained to evaluate the overall woman's health. According to educationportal.com, to become an OBGYN, it would take around 12-15 years, and the way that would be planned out is 4 more years in classroom instruction with any major as long as the science prerequisites are met, and to get my bachelor's degree, and to get my medical school degree, I'd have to go to 2 years of classroom instruction and then 2 years of clinic or hospital training. Then I'd have to go to a 4 to 7 year OBGYN residency, providing patient care in a clinic or hospital, and then finally I'd have to obtain my state licensure and my board certification. OBGYN residency programs tend to go by like a year-by-year schedule, where residents are given increasing responsibilities and hands-on experience. They usually follow this kind of schedule. Year 1 is usually the introduction to patient care, including rotations in critical care, gynecologic surgery, and outpatient treatments. Year 2 is increased exposure to obstetrics, that word, along with continuity in clinics, which is a resident-run, faculty-administered facility. Year 3, residents would spend more time in surgery and are given increased patient care responsibilities. Year 4, residents are given titles such as like chief resident, associate, and typically work for 6 months in gynecologic surgery and then 6 months in obstetrics, providing independent patient care, and as well as like they would supervise the junior residents. To get my state licensure, I'd have to go to the United States I'd have to take the United States Medical Licensing exam, and then I'd have to take the board exams, which are split into 2 separate times. One right after my residency, and then one 2 years after OBGYN practice. And finally, you'd be an OBGYN. And that's the information I gathered on the career path of an obstetrician and gynecologist. Hope you enjoyed.